I am a woman. This is me. For some reason, I hide. I await. Obviously, there is something I don't want to face, like being an object or known as a beauty. Yes, I am a woman. You kill me when you realize I am a girl. Celebrate when I start my periods, but when I bleed every month, you treat me as an untouchable. I am objectified, treated as a non-entity. Rape is just a word now. Mother, wife, daughter, sister, friend, colleague. I am all these and much more. Realize my worth. Remember my love. Today, I am celebrating women's health. I'm sure you can change, take care of my health. Won't you? Won't you take care of her health? Good evening.
Hello, ma'am. Good evening, ma'am. Network is very bad. I am having a lot of troubles. I'm very sorry, but somehow it's very troublesome today.
Good evening, everyone present here.
Am I audible? I think I'm audible.
Yes.
Thank you. Sorry, because of network problem issue, we have started the session little late. Okay. Once again, good evening. I am Anupama Borgohain, a holistic health and life coach. In collaboration with the ARHI Hospital Guwahati, I warmly welcome everyone to this awareness session in observance of the International Day of Action for Women's Health. It's truly heartening to see so many of you joining us in advocating for the holistic well-being of women. In a world where women play multifaceted roles as nurturers, caregivers, professionals, and pillars of strength, addressing their health needs comprehensively is crucial. Today, we come together to acknowledge the challenges women face and to celebrate their resilience and strength in the face of adversity. As we discuss women's health, let us remember that health is not merely the absence of disease, but a state of complete physical, mental, and social well being. It's about nurturing the body, mind, and spirit in harmony. Mental health, often overlooked and stigmatized, is a crucial aspect of overall well being. It's time we recognize the importance of mental health for women and advocate for accessible and inclusive mental health services. Let us create a safe space where women feel empowered to seek help, where their voices are heard, and where they are supported on their journey toward healing and self-discovery. Today's event is not just about raising awareness, it's about catalyzing action. It's about fostering a community of support and solidarity where we stand together in our commitment to championing the health and rights of women everywhere. So let us engage in meaningful conversations, share our stories and experiences, and place to be advocates for change. Together, let us strive to create a world where every woman has the opportunity to thrive and where her health, body, physical, and mental is nurtured and prioritized. Once again, a heartfelt welcome to all of you. Thank you for participating in this important session. Now, I'm honored to invite Dr. Kahkasha Rahman Chaudhury, a pediatrician, neonatologist, and pediatric cancer specialist at ARHI Hospital, to share her insight on access to quality healthcare, the physical, mental, and social changes of a teenage girl, and non-communicable diseases. Thank you, Dr. Kahkasha.
Okay, good evening, everyone present here. I am Dr. Kahkasha Rahman Chaudhury, Senior Consultant.
You are not audible, Dr.
Uh, Okay, am I audible now? Am I audible now? Okay, thank you. I would like to share my screen if it is. I'd like to share my screen, which is disabled is there. Sharing screen sharing. Can I do it? Screen sharing. Screen sharing can I do? It is permitted.
Yeah, you are not audible. That's why. Sorry. Now I'm listening.
Am I audible now?
Yes, yes. For me,
Okay.
you are audible.
So
Yes, now.
actually, I would like to share screen.
Okay, I'm making you a host then so that you can please accept this.
Share sound. Okay. So, so is my screen shareable now? Can everyone see my slides? It starts with Women's Health Day 2024. Excuse me. Is my screen shareable now?
Yes, yes, yes.
So the topic Women's Health Day 2024. Okay, it's me from Dr. Kahkasha Rahman Chaudhury, Senior Consultant, Pediatrics, Neonatology, and Pediatric Cancer, ARHI Hospital, 11th Mile, Jorabat. So I welcome everyone to Women's Health Day 2024. So what is Women Health Day? Women Health Day is an annual event. It is celebrated worldwide on this day of 28 May. So this is mainly to create awareness about women's health and promote education about prevention. And this year's theme is empowering women and transforming health. So the women themselves must work towards the health of themselves. Or we all should help, but women themselves also should be empowered. They should be given that much power so that they can transform their health themselves. So this is the main theme of this year. So what is the main purpose of Women's Health Day? The primary purpose of Women's Health Day is to create the awareness about the unique health challenges, promote access to healthcare services and preventive screenings, advocate for gender responsive health policies and programs, and empower women to take control of their health and make informed decisions. So first I would like to talk a brief about access to the quality healthcare in reference to women. So first of all, there we will talk about the financial barriers. So there is limited financial resources is the factor. So limited financial resources can lead to decreased access of women to the health centers. And there are other factors also like lack of health insurance or inadequate coverage is there, which are not done by many other family members for the women.
তাতে মই কাম কৰি
These are
আছো
the
মই
different
কিতাপ
types
পঢ়ি
of
আছো তো
financial
মোবাইলৰ
barriers which
মোৰ এইটো মিছ না
hinders
মোক শিকি আছে
their health.
দে
So let's go to the geographic barriers. So women living in rural or remote areas.
আমি
So women who live in remote
মই শিকি
areas,
আছো তুমি
so what
আমাকে
happens? They can't get access to the healthcare facility. And then there is another factor like transportation options. Transportation options are also very less. So the next is cultural and language barriers. So there are many cultural norms and beliefs. So in cultural norms and belief, they have some cultures they don't permit to say freely about the mental health, sexual health. So these cultural norms and beliefs are also a part of a barrier. And then language barriers. Some women are not comfortable in other language. They don't want to get so for that they can get access to the healthcare providers. Then there is lack of education and health literacy. So limited education and health literacy, it leads women not to understand the health problems and whether why health is more important for them. And there are also many misinformation and misconceptions. Then there is gender bias and discrimination. There are in healthcare settings, there are sometimes gender bias, and their discrimination is based on gender identity, sexual orientation, race, ethnicity, or socioeconomic status. Then family and caregiving responsibilities are also a barrier to access of quality healthcare for women. Like balancing family and caregiving responsibilities, for that they can't prioritize their own health. And then lack of support systems or childcare options, they for these reasons they can't get access, they can't get even time to go to healthcare centers because they don't get support systems to take care of their children. And there are also some stigma surrounding certain health issues like mental health issues. Many women doesn't want to don't want to talk about their mental health or sexual health. So this stigma, these are barriers or for the access of women to quality healthcare. So next I will talk a little about the changes of a teenage girl. So the teenage years marks a critical period in a woman's life, and it is characterized by rapid physical, emotional, and social changes. So, with respect to physical health in teenage girls, there are various important aspects such as puberty and hormonal changes. The onset of puberty is actually triggers a cascade of hormonal changes leading to the development of secondary sexual characters and menstrual cycle. Menstruation, it is a natural part of a woman's reproductive cycle. It can be accompanied by discomfort, pain, and irregularities. So these things should be educated to women and proper guidance to be given to all women so that they have any discomfort, they can get access to the health facilities. Other about physical condition is they should addressing about common nutritional deficiencies, then promoting healthy eating habits and debunking myths surrounding diet and weight management are also important. And exercise and physical activity. This exercise and physicality not only improves the weight of the, but also it improves mood, self-esteem, and a very always the this regular physical activity leads to always a happy mood mostly. So the next thing is about the sexual health of teenage girls. So we should talk about the sexual health of to the teenage girls. What is important? What the idea about contraception, about sexual reproductive infections, and the consent. We should talk to them about these things. Then mental health. So mental health also sometimes it is like emotional well-being, handling peer pressure and competition, promoting body positivity, self-acceptance, and stress management should be given priority. So these things are the I want to just say about the changes in a teenage girl. Then next, the last point, which I just want to say in brief, there are some non-communicable diseases which are thought to be more common in male, but they can manifest in females also in different ways, like cardiovascular diseases. They can these many things like high blood pressure, high cholesterol. These are also always most of the time associated with cardiovascular diseases. So proper and regular health checkup of the um, cardiac circulatory system should be done for women. And also some cancer like breast cancer, cervical cancer, proper screening should be done from time to time for women for early detection of cancer so that it can be treated. Then diabetes, regular sugar monitoring and all should be done to women to exclude diabetes, because diabetes is also associated with other cardiovascular diseases and all. Then respiratory disease may be associated with women. Then mental health disorders like I explained in teenage girls, it can be happening in all age women groups like anxiety, depression, peer pressure, more competition. These are seen more in women. Then other diseases like osteoporosis, they are also postmenopausal women get more prone to osteoporosis. And other like autoimmune diseases like rheumatoid arthritis and all are also seen more in women. So these things should be kept in mind while they access to health facilities, especially when they grow to a more age. So, concluding, I just want to say that this year's theme, like empowering women, so we all should contribute to the health of the women, and we women are our duty also of all women to um, contribute to our health. It is our duty to look after our health also, besides looking our family members also. So, thank you.
Thank you so much, Dr. Kahkasha, for that informative session. And now I would like to invite Dr. Gaganpreet Kaur, consultant gynecologist at ARHI Hospital, to enlighten us about sexual and reproductive health of women, sexually transmitted infections and diseases, the right to abortion and post-abortion care, contraception, and maternal health, etc. So I would request Dr. Kahkasha, please make Dr. Gaganpreet Kaur as a host. And you can bring her a spotlight first, and you can make her a guest, as host. The there is there are three dots upper right corner. If you click there, then you can get.
Good evening, everybody. Am I audible?
Yes, Dr. Gaganpreet.
Good evening, everybody. Till the time she makes me a host. Thank you so much for making us a part of this wonderful enlightenment. I am Dr. Gaganpreet Kaur. I am a consultant gynecologist at ARHI Hospital, that is in Jorabat, Guwahati. Today, I will be talking about sexual and reproductive health. Please make me the host. I actually want to share my PowerPoint presentation.
I went to more than how to invite the host, which options?
Use it. Just see on the right upper corner. There are three dots. Click
Okay,
there.
this right? I can get it in the bottom, 3 dot more. Yes.
Yeah, 3 dot, then click
Yes.
there,
Yes.
and then you can make that is for Dr. Gaganpreet Kaur. You just go to Gaganpreet Kaur profile, upper, and there you can make her host.
Okay, okay, make host.
Or
Yes,
you can make me host also.
I did.
Yeah, now you are host, Dr. Gaganpreet.
All right.
Yeah.
All right. Just give me 1 second.
And you can keep yourself in a spotlight also.
Just 1 second. I'm sorry for this delay. My network is troubling me. I will just take 1 more minute of yours. Google Drive. No, I am sorry to. I am unable to share, madam. I am trying it repeatedly. Google Drive. Just a second. Ma'am, can I send it to you, Dr. Kahkasha? Can I send it to you? Can you do it for me?
You are not audible, Dr. Kahkasha. Unmute
Please
yourself.
send me to my email now. I can open them. Email. Dr.
I'll mail it to you.
In the meantime, if anyone has any question, you can ask, or you can ask in any language. Actually, since it is International Women's Day, that's why we are conducting this session in English and Hindi. In fact, most of us are Assamese, so you can ask in Assamese also. Dr. Kahkasha can reply in Assamese also. And I think everyone knows Hindi, so you can ask anything. So,
Simran?
you can write your question in the chat box also.
सर्विस में कुछ नहीं है, Google Drive में भी नहीं है.
किंवा কিবা কুৱেশ্যন আছে যদি সুধিব পাৰা তোমালোকে মুনমুনি মাইনু
So I'm not the host now. I'm the host function.
Ma'am,
Yes.
hello.
गुड इवनिंग।
या जूरी,
मैं पूछना चाहती हूँ, एक माँ होने के नाते मैं ये पूछना चाहती हूँ कि मेरी बेटी की प्यूबर्टी के समय मैं उसे किस तरह से जागरूक करूँ और पौष्टिक खाने के और उसे और हाइजीन के और उसे जागरूक करूँ, मैं ये पूछना चाहती थी।
देखिए, पहले तो बात है कि पुबर्टी के तक आप लोग को नहीं वेट करना है। पुबर्टी के 1-2 साल पहले ही से ही आपको उसको नॉलेज देना है कि एक मेंस्ट्रुएशन एक नॉर्मल पार्ट है ऑफ वीमेन का। नहीं तो
हाँ
क्या है ये, तो आपको पूरा अच्छे से नॉलेज देना चाहिए कि मेंस्ट्रुएशन क्या है, क्यों है, इसके रिप्रोडक्टिव साइकिल में ये इम्पॉर्टेंट है, सारी वीमेन के होते हैं। और फिर आपको कैसे नैपकिन्स यूज़ करने हैं, कैसे अपना हाइजीन रखना है, अपने आप को कैसे साफ रखना है, पैड्स चेंज करना कैसा है, वो आपको अच्छे से पहले से नॉलेज देना चाहिए। और एंड आपको अगर लग रहा है नेक्स्ट 1-2 ईयर्स, मतलब अराउंड 9 ईयर्स 8 ईयर्स में तो आजकल लड़कियां प्यूबर्टी गेन कर ही रही है, तो
हाँ मैम, आवाज नहीं आ रही है आपके। हेलो मैम। हेलो।
you are not audible, Dr. Kahkasha. नहीं आ रहा है, no voice.
एडमिन तो ठीक है। हेलो,
एक्चुअली
Uh,
अभी आ रही है क्या आवाज़?
yeah, but your voice is too low.
ओके, अभी आ रही है आवाज़? ठीक
हाँ
है,
मैम,
हाँ सुनाई दे रहा है ना?
हाँ
ओके,
हाँ
अभी ठीक है ना?
हाँ
ओके, तो आप पूछ रहे थे आपकी बेटी की पुबर्टी के लिए आप क्या क्या नॉलेज देना चाहते हैं।
हाँ वही।
पुबर्टी रीच करने के पहले 1-2 साल पहले से आपको अपनी बेटी को पूरा
दीदी,
मेंस्ट्रुएशन फर्स्ट ऑफ
इसमें
ऑल,
भी अपडेट नहीं हो रहा है, वो क्या है?
तो मेंस्ट्रुएशन के बारे में
मेरा
समझाना है
एडोन
कि ये हर मंथली एक साइकिल है जो आने वाला है, ये नॉर्मल है। और उसमें क्या होता है, आपको सैनिटरी नैपकिन्स का यूज़, अपने आप को साफ रखना है, तो वो भी नॉलेज देना है आपको। फर्स्ट ऑफ ऑल फिजिकल, अपने खाने के बारे में भी अच्छा पौष्टिक खाना चाहिए, वो भी पूरा बोलना चाहिए। और पुबर्टी के टाइम आपका इमोशनल चेंजेस भी ज़्यादा हो जाता है, वो थोड़ा अचानक चेंज एक हो जाता है आपके, मतलब
हाँ
प्री पुबर्टी और पुबर्टी होने के साथ साथ इमोशनल चेंजेस ज़्यादा होने लगते हैं, कुछ और ऐसा लगता है कुछ और ही सोच रहे हैं आप। इमोशनल चेंजेस, पीयर प्रेशर लगेगा ज़्यादा, आप एंजाइटी हो जाएंगे, छोटी छोटी बातों को लेके एंजाइटी हो सकता है। तो आप पहले से आप काउंसिल कीजिए अपनी बेटी को कि ये सब हो सकता है और ये नॉर्मल है। ऐसा मत नहीं सोचना कि पहले मुझे तो नहीं होता था अभी हो रहा है, तो दिस इज नॉर्मल पार्ट ऑफ दिस फेज। तो आपको ये ध्यान, मतलब उसको समझाना चाहिए। एक तो पौष्टिक खाना, न्यूट्रिशन, एक तो मेंस्ट्रुएशन के बारे में नॉलेज, और इमोशनल वेलबींग, और एक सेक्सुअल हेल्थ उसके बारे में अच्छे से समझाना चाहिए कि आपका तो ये कॉन्ट्रासेप्शन का नॉलेज, ये सब पहले से देना चाहिए कि क्या कॉन्सेंट क्या चीज़ है, ये सब आपको पहले से ही बोलना चाहिए कि मतलब राइट टच, इनकरेक्ट टच क्या चीज़ है, ये पहले से ही नॉलेज देना चाहिए। तो गर्ल विल बी मोर अवेयर, वो अपने आप को थोड़ा सा सेव कर सकेगी।
मैम, थैंक यू।
डॉक्टर गगनप्रीत
भैया
कौर,
मिला?
Okay, Dr. Gaganpreet, are you ready?
Yes, ma'am.
I think Dr. Kahkasha will share the presentation and then you start. Okay.
send to email.
Uh, am I audible?
Yes, yes.
All right. I have sent it to Manoranjan. Manoranjan, can you help me with it?
Email, please send.
I have sent it to Manoranjan, ma'am.
Okay, okay.
मैम आपका ईमेल में अटैचमेंट नहीं है,
Okay, I'll retry.
अदरवाइज आप व्हाट्सएप में भी दे सकते हैं।
All right. Ma'am, since this is troubling, can I talk without showing a slide? I am comfortable talking. Will it be okay with everybody?
Yeah, yes,
Because
yes,
I am absolutely fine with all of that.
yes. Please start.
I'm sorry for this delay, but
It's okay. Yeah, please start without the.
all right. So, okay, my topic today, good evening, everyone, and I sincerely apologize for this shortcoming. I am unable to actually correct it. So today I will be talking about sexual and reproductive health of women. All right. So sexual and reproductive health, what are these? These are human rights. Human rights means a woman has the right to define her own sexuality and her sexual orientation, her gender identity. She can decide when she wants to be sexually active, whom and when she wants to marry, to have a safe sexual experience. And she can also have a say in how many children and when she wants children. This is her right. Apart from this, apart from this, she has a right to lifetime access of information, resources, services, and support necessary for all of this. And for this, she should not be discriminated. She should not be exploited. It is her choice. We have to respect this. So these are her rights. These are human rights. And these rights are universal. It is for everybody. It is not selective. And these are undeniable. We cannot deny any woman of these basic rights. So this is sexual health. Sexual health kya hai? What is sexual health? Sexual health does not mean that you are not diseased. You don't need treatment. No, that is not good sexual health. Good sexual health is you have the decision-making power, the autonomy, and the liberty to choose your sexuality and all its aspects. It comes with many aspects. So this is your right. This is sexual health. Just the mere absence of reproductive tract infection is not sexual health. Now, the situation in India is bad. So we need sexual and reproductive health. So let us start right from Minak. जब puberty start होती है girls में, उस time से बात करें तो age of puberty भी कम होती जा रही है. 9 years से शुरू हो रहा है. The general age is still 11 to 13 years. And 50% of girls, जब उनको menses start होते हैं, then they realize, oh, what is wrong? What is happening? That is the time when they are told about something like menses. So it is a taboo. किसी को बात नहीं करनी. Nobody wants to discuss. अच्छा, ये हुआ मिनाक हो गई 13 years में. By the time they are 18 years old, you will not believe it when I say 54% of these girls are already married. They do not even know what is minak, what is menses, what is menstruation, what is childbearing, and they are married by the time they are 18 years old. All right. Am I audible? Sorry.
Yes, you are
All
audible.
right. Okay. अच्छा, इसके बाद 18 years के बाद these women, the most striking part that I found very distressing was that even if when they were asked, these girls, when they were asked, 90% were still aware of contraception. हाँ, ये क्या है, कैसा है? But less than 10% were actually using it in spite of having the knowledge, in spite of having an access. पता भी है, मिलता भी है, but usage नहीं है उसका. So it was seen that 35% of girls already had children by the age of 17 years. And by the time they were 24 years old, they already 30% had 3 or more children already. तो आप अपने reproductive cycle आपने शुरू किया 13-14 years की age से, and you've already had children by the time you're 24. So इस time में when your body itself needs care and nurturing, you are bearing and rearing another kid. So that is something depleting your body. Okay. तो ये सब करके कोई फायदा भी नहीं हो रहा, क्योंकि जो neonatal mortality है, जो the kid that is being born, उसमें इन women में देखा गया है कि जो mortality होती है, इनकी death इनके बच्चों में, that is 54 per 1000 live births. हमारी इंडिया की national mortality on average is 25 die out of 1000. But in these women, In these women, the neonatal mortality goes up to 54, just the double. So there is no point. Early marriage, early children, you have 3 also. But look at the neonatal mortality. It is not helping you in any way. इसका कोई फायदा नहीं हुआ. Okay. Apart from that, इतना लंबा reproductive life में repeated sexually tract infection होना, this also predisposes to so many other factors. The last one terminating into HIV if it is unprotected and infected source of infection. So it can, itna lamba reproductive lifespan mein, they will be repeatedly exposed. So apart from that, 44% of cases of AIDS, that is also seen in this vulnerable age group of 15 to 29 years old. Then, even if these women conceive, pregnancy ke baad bhi, there is no antenatal care. Hospital mein dikhana, there is nothing like that. Intranet delivery, there is no institutional delivery. Postnatal care, that is also very poor. So, ये situation से हम ये समझ सकते हैं कि you cannot think of bold topics like abortion, unwanted pregnancies. ये तो unaddressed ही रह गई, ये वैसी ही रह गई. Then, because of this, what happens? There is family pressure. They cannot undergo a safe and institutional MTP. No, they opt for these wrong kind of medical termination of pregnancies. And as I say, each day, if you look at the census, 13 girls in this age group are dying because of unsafe abortion. 15 to 24, such a vulnerable population. And unsafe abortions in this age group is the second commonest cause of female death. Just imagine a girl of 15 to 24 years dying because of unsafe abortion practices merely because of lack of knowledge. So what are the reasons? हम ऐसी situation में कैसे आ गए? So let us start with the earliest topic, that sexuality is still a taboo. Nobody wants to discuss. Nobody wants to talk about all this. Parents also, many parents disapprove of their children being information कि ये बात नहीं करो, ये तो गलत बातें हैं. Then there is no proper sex education in school. ये 3 chapter घर पे पढ़ के आना है, इसके बारे में बात नहीं होगी. There will be no questions from this chapter. Nobody wants to talk. Nobody wants to be involved in all this. Then early marriage, gender inequality. We give preferences to male in all our fields, because of which the females suffer. And the contraceptive decision of young women or women are governed by so many factors. They're governed by, say, maybe lack of knowledge. Even if you have knowledge, you've got many people who will decide for you. You do not have an autonomy. कोई नहीं बोलेगा कि नहीं आप सोच के बताओ आपको क्या करना है. No, it is like नहीं ये तो गलत चीज है, ये तो करना नहीं है. क्या हो गया, एक और पल जाएगा, दिया है भगवान ने पल जाएगा. You don't consider the lady's decision. It is not important at all. It is just लोग क्या कह रहे हैं, उनकी बातें हम पहले सुनेंगे. So all this, so the women doubting themselves, too much dependent on others and not even bothered for themselves, their health. So I wanted to share a basic knowledge of menstrual cycle. कि हमारी what we can do, ये सारी situation we cannot help it as of now, but what we can do at least that. So अगर एक basic understanding हम एक menstrual cycle से समझे, जो हम किसी को समझा भी देंगे कि the day you're bleeding is day 1. Let us consider that day 1. The first 5 days you're bleeding, all right? Next 5 days, 5 to 10, 5th to 10th day, आपकी lining दोबारा बननी शुरू होती है. What is bleeding? The uterus is shedding its lining. That is menstruation. Okay, the lining दोबारा बननी शुरू हुई है. All right, that is 10th day. Then on day 14, generally, day 14th में ovulation होता है, egg बनता है. All right. Then this day of ovulation, the ovum will last for 1 day. All right. And the semen, the human sperm, can last for 5 days. तो अगर आपको एवरेज किसी को समझाना हो कि आपकी फर्टाइल विंडो क्या है, आप ये बोलोगे कि जो आपका डे ऑफ ओव्यूलेशन होता है 14th डे जनरली होता है, उससे 4 दिन पहले और 4 दिन बाद, that is the period, it's called a fertile period. So you can say roughly from day 11th to day 17th or 18th. Now how is this knowledge helpful? ये इससे हमको क्या फायदा हुआ? इससे 2 चीजें क्लियर हुई. For all patients, for all women who deal with infertility issues, if they have a sexual relation during this time, chances of conception are high, and vice versa. If you have a knowledge of this phase, you can avoid or use other kind of contraceptive, preferably barrier condoms, so you can avoid pregnancy. So this knowledge is important. You can use this knowledge to your strength. But the drawback, the fallacy here is कि ये strict उन्हीं में follow होगा जिसका 28 to 30 days cycle होगा, उसके 14th day में ovulation होगा, और इसके लिए हमें 4+4 8 days का margin can work. This happens in 30% of cases, but still we know that yes, before menstruation, those 4 days, very low chances of conception. Immediately 3-4 days after menstruation, low chances of conception. So this can be used. This knowledge can be used to our strength in both ways, infertility and to prevent pregnancy. Okay, so this was fertile window. Iski knowledge hum rakh sakte hain. Okay, second biggest taboo is reproductive tract infection. Iske baare mein nobody wants to talk, be it man, be it woman. The symptoms are very vague and the prevalence is very high, up to 40% of women and men. तो reproductive tract infection में सबसे बड़ी बात ये बतानी जरूरी है कि ये 3 तरीके से हो सकता है. एक होता है एंडोजीनस, इसका मतलब आप ही के अंदर के ऑर्गेनिजम्स जो गुड बैक्टीरिया है, but because of your physiology changing, women physiology changes every cycle, every month, menstruation, pregnancy, lactation, आपका hormonal environment change हो रहा है, तो कभी कभी आप ही के आपके बैक्टीरिया they infect you. तो endogenous infection कहते हैं. It's a very common cause, endogenous infection. I will mention why I mentioned this. Second cause is iatrogenic. आप किसी डॉक्टर के पास गए, उसने कोई आपकी DNC की, कोई प्रोसीजर किया, गलत तरीके से किया, so again you can contact an infection. And third is a sexually transmitted diseases, third group of infection. Now, reproductive tract infection endogenous अगर होता है, these young girls who are not sexually active, they are hesitant to tell their parents कि नहीं आई itching सी लग रही है, discharge सा लग रहा है, because they think no, the parents will think that she is engaged in some sexual activity. It's a very big taboo. They don't want to tell you at all. But endogenous भी होता है, depending on the cycles. तो ये infection की complaints क्या होंगी? There will be lower abdominal pain, any discharge, mild discharge, discomfort, ना frequency of urine, ऐसे होंगे. If it is a proper sexually transmitted disease, फिर उसमें genital ulcers बनेंगे. That is a different story. So this endogenous RTI, this is a very big taboo. Nobody wants to discuss, because अगर आप अपनी एक लड़की girl child को लेके gynecologist के पास जा रहे हैं, you cannot think of how many people and their ideas they'll come up with. But this is important to realize कि endogenous infection भी हो सकते हैं. जरूरी नहीं है कि sexually transmitted infection हो. It is important to listen. It is important to consider another possibility, not necessarily some sexual activity. Okay, this was one. Then, if this is not treated, अगर हम इसे नजरअंदाज करते हैं, right, तो इसके consequences क्या होते हैं? तो reproductive tract infection नीचे से infect करते करते ऊपर की lining को infect करता है. It goes to the tubes, fallopian tubes को infect कर दिया, जिसकी वजह से infertility होती है. Tubes infect हो तो वहाँ ectopic pregnancy बैठ जाती है, tube में pregnancy बैठ जाती है, और आगे चली जाए intestines में infection हो सकता है. And if it is a human papilloma virus, it can also predispose to cervical cancers. So this is one. Secondly, HIV infection, जो sexually transmitted होता है, always presents with these vague symptoms. So HIV in young, we've heard the incidences of HIV in young ages. तो ये HIV का भी एक खतरा हो सकता है. Okay, so अब बात है कि sexually transmitted infections are very common. हम ही कह रहे हैं percentage 40% है. इसके लिए WHO has made it very clear that हमें कोई test नहीं कराना. We've got these kits 1, 2, 3 for color-coded kits. जैसे women complaints of any discharge. So fixed kits हैं. I'm sorry I cannot show it to you. I would have shown you color-coded kits. So okay, this group is lower abdominal pain. Yellow kit. Okay. This kit is vaginal discharge. Okay. It is so prevalent. It is so common. It is not something that is rare. The kits are available. It's called syndromic management. आप हमको बताइए क्या complaint है? Fine. कोई test नहीं कराना है. It is okay. You take this kit. But with this kit, you have to treat your partner. There are certain things that you have to do when you take this kit. You have to treat your partner. If you are still in a sexual relationship, please use a condom. and do come up for follow-ups. ये 3 चीजें हमें करनी है with this kit. So these kits are made available so that you prevent later consequences. आप ectopic pregnancy नहीं चाहते, आप infertility नहीं चाहते हो. Just for STI, just such a trivial thing, इतनी छोटी सी बात के लिए, a woman becoming infertile, we've seen instances, that is very sad. You just have to take one kit. This is called syndromic approach. बहुत कोई test नहीं कराने हैं, कुछ नहीं करना है. You just tell me the complaints, okay, this is your kit. You take this and treat your partner with this kit. That is it. It's called syndromic case management. This is given by WHO. Okay. So abhi, when women, they plan pregnancy, 50% of the cases are unplanned. That is sad. Okay, हो गई pregnancy. Antenatal care, hospital में दिखाना. ऐसा कहा जाता है कि एक visit आप जब आपको pregnancy पता लगी, पहली visit करिए. दूसरी visit आप अपने बेशक 5th, 6th month पे करिए. तीसरी आप 8th month में करिए. चौथी आप 9th month में करिए. इतनी बार भी अगर आप दिखा दें, 4. India just says, just come to the hospital 4 times. That is it. अगर इतने में भी दिखा दें, there are many things that are covered. But this antenatal care is hardly taken by 50% of the women. These 4 visits are also not done. All right. After this, institutional care, delivery. Institutional delivery is still a distant dream, not achieved. Abhi bhi ghar pe delivery, दाई se delivery, this goes on. All right, just a minute. I'll just put my charges. After that, after this, postpartum care. Postpartum care is as essential as antepartum, मतलब delivery के बाद की care. इसमें आप एक लेडी से सारी बातें कर सकते हैं, समझा भी सकते हैं, right from nutrition, hygiene to contraception. ये इस टाइम को हम कहते हैं कि जितना इस टाइम एक लेडी contraception accept करेगी, कोई और नहीं करेगा. And ये भी इसका personal decision है. Contraception, we are blessed to stay in a country where all this is not something जिसके लिए case हो रहे हैं. No, it's free. It's available. Knowledge is there. It's not a taboo. It's done. Okay. Now coming to the most important topic, medical termination of pregnancy, MTP Act. MTP Act 1971 से हमारे country में है. Okay. और ये कहता है कि ठीक है, up to 3 months of pregnancy, एक gynecologist या registered medical practitioner, RMP जिसे हम कहते हैं, can give you abortion facilities. Done. Up to 20 weeks में पहले ऐसे था कि 2 डॉक्टर मिलकर डिसाइड करेंगे, एक लेडी करा सकती है. That was also fine. Recently in 2021 there have been very big amendments. बहुत बड़ी changes हुई हैं. पहली change ये है कि अब 3 महीने तक नहीं, एक डॉक्टर 5 महीने तक एक लेडी की कंसेंट से उसका एबॉर्शन कर सकता है. दूसरा, 6th month 24 weeks 20 to 24 weeks जो है, उसमें 2 डॉक्टर अगर डिसाइड करते हैं तो एबॉर्शन हो सकता है. Let us take it a step further. If there are cases when pregnancy exceeds 24 weeks, so there is a state board. एक state board बैठता है जिसमें gynecologist होता है, एक pediatrician और एक ultrasound sonologist. ये तीनों अगर डिसाइड करें, yes, this pregnancy needs termination. बहुत reasons हो सकते हैं. There was rape, there was mental illness, fetus में, बच्चे में बहुत गड़बड़ी है, या divorced है, separated है, doesn't want to continue. अगर लगता है कि grounds realistic हैं, she can always be offered abortion facilities. और जितनी pregnancy advance होती है, उतनी हमारी anticipated procedure बढ़ते हैं. मतलब she might require operative procedures, but if she wants it और वो ground बनता है, she has to be given. So this is respecting reproductive health, one step towards respecting sexual health of the woman. अब MTP Act आप कहोगे कि इसकी तो जरूरत ही नहीं पड़नी चाहिए, everybody has to be precautious. But no, what we forget is हर contraception का अपना failure rate है. जितना भी आप अच्छे से use कर रहे हो, whatever it is, there is a failure rate. Failures are bound to happen. इसीलिए if you have a backup that supports you, then nothing like that. So these amendments of MTP, it's a very big boom for us, a very big wish. All right. Then the point is, अगर इतना कुछ है, then why still 15 to 24 years में आप कह रहे हो कि every day 13 girls are dying? You're saying 50% of the abortions are illegal. Why? The prime reason is they do not know. People do not know. A woman, married, unmarried, nobody asks. Above 18 years, it is her consent. Usko abortion karana hai, she can go to any institute for a safe and institutional abortion. Nobody can deny her right. Nobody has to justify. If she says, nahi, mujhe abortion karana hai, nobody can justify, nahi rakho, nahi kyun karana hai. No, it is her right. She should not be questioned. This is her right. ये उसको पता होना चाहिए. नहीं तो आप जाओगे, डॉक्टर बोलेगा नहीं नहीं रखो रखो. Why? It is her right. Nobody is supposed to ask her. अगर वो कहती है नहीं मेरे को मुश्किल है, उसके वो मेंटल हजार्ड है, आप उसको रिस्पेक्ट करो उस चीज को कि नहीं उसको फिजिकल प्रॉब्लम ना भी हो, वो उसके लिए एक मेंटल हजार्ड है. शी इज नॉट विलिंग टू बेयर, so you cannot ask her to keep. Then, so this is lack of awareness. They do not know that yes, we have these facilities. She can avail these facilities. Then comes a big role of gender discrimination, male-dominated society. She cannot take her step forward without permission of elders and her husband. This is our society. We have to accept it. Okay. There are too many decision makers around her. She does not have an autonomy of decision. Then ignorance about contraception and lack of male participation in contraception. It is seen that males do not intervene too much if there is unintended pregnancy because they don't have to do anything in it. So they do not intervene much. Lack of male participation. Apart from this, yes, as an Indian doctor, I would say, yes, we are also at fault because we do not have those numbers of safe abortion services, those number of doctors in peripheries to outreach women everywhere. Yes, there is ignorance on our part also. जितना अवेयरनेस होना चाहिए था वो नहीं है. एग्रीड. देयर आर वीक रेफरल लिंकेजेस आल्सो. अगर एडवांस प्रेगनेंसी आ रही है 5 मंथ्स के ऊपर, अगर मैं अकेली मेडिकल प्रैक्टिशनर हूँ, आई शुड रेफर हर टू अ प्लेस वेयर 2 people are sitting, but I might be reluctant. नहीं घर जा 5 महीने तो हो गए, 4 महीने और. So this is also the attitude. Then economic factors. It is expensive to get it done in a private setup. In a government setup, may or may not be done on time. Then there is scarcity of trained providers in underserved areas. That is also there. Now, with abortion comes a post-procedure counseling. When abortion facilities are given, so there has to be counseling about precaution, counseling about prevention of another unplanned pregnancy, contraceptive counseling, and you reinforce the need for contraception. If you would have followed that contraception earlier, this would not have happened. Even if it has happened, let us restart. Abuse karke dekho. Now prevent, because it is to safeguard yourself first. So there are various contraceptive methods. Common is male condom is there. Then we've got intrauterine devices. Copper T आता है. उसकी जगह hormone implants आते हैं. Hormonal pills आते हैं. इसके अलावा the last step is sterilization, जिसको हम नसबंदी कहते हैं. That is the last step. So whenever we discuss about all this, ऐसा लगता है कि why are we discussing all this? But इसको ऐसे सोच के देखते हैं कि if not you, then who? If not here, then where? And if not now, then when? So this is the right time. This is absolutely the right time to talk about it, to know all this, and to help someone who doesn't know. Just to tell a simple thing, say, aap le sakte ho dawai. Why can't you abort? It's your right. Why you have to live for yourself also. So this is important. This is important to convey. So on this day, I think, yes, if this message goes around, then we'll make a small contribution in some way. So with this, I summarize and I apologize for not showing my presentation. Thank you.
Thank you. Thank you so much, Dr. Gaganpreet, for your invaluable knowledge. I have also learned this new thing that yes, women has right to abort if they don't want. Yes. So there are some questions to you. So first question, you can also check in chat box, but first question is written in Assamese. That's why I'm reading for you. It's Bidisha Datta. She wants to know about the precautions for urine infection.
No, she wants to know. Sorry, I did not get your question. She wants to know the
urine infection, UTI.
UTI. What about UTI?
Precautions. What precautions do we have to? Yeah.
All right. Okay. So Bidisha, right? Bidisha wanted to ask me. Okay. Hello, Bidisha. It is a very appropriate question and a very, very frequent cause. So urine infection normally presents as sudden burning sensation, urgency, uncontrollable pain, right? So the commonest reason why it happens is it is because of water deprivation. आप पानी नहीं पी रही हैं ज़्यादा. All right. So that is one reason. पानी नहीं पीना alone cannot help it. There has to be something that is precipitating urine infection. कई लोगों में देखा गया है कि if supposing you are sexually active and either of them is slightly infected, husband or wife, it precipitates very quickly in a woman overnight. You can make out ki nahi, you can sense urine infection. So one is, yes, definitely there is some infection on either side. If it is not you, it is your husband. All right. Then the second and the commonest reason which I have seen, and I think that synthetic undergarments से vaginal discharge, vaginitis भी बहुत होता है, और urethritis, itching, ये भी बहुत होता है. So avoid those. It's very important to avoid those. Have plenty of fluids. And there is another thing I will tell you. जब ऐसे UTI होता है, right? You can always take one tablet, one medicine of Urispas, because जब हो गया, you cannot help it. You will treat yourself later for these vaginitis and all. But generally, you take one tablet of Urispas. कई बार, as I mentioned, it is endogenous. आप नोटिस करिए आपके मेंसेस के तुरंत बाद या उससे थोड़ा सा पहले जब मैक्सिमम फ्लक्चुएशन ऑफ हार्मोन में होता है, इवन इफ यू डोंट हैव अ सेक्सुअल कांटेक्ट, यू नोटिस इट ड्यूरिंग दोस टाइम बिकॉज आवर लाइनिंग keeps on shedding and there's so much going on inside a woman. So it can be endogenous infection also. So this endogenous infection can also subside after 2-3 days without antibiotics also if it is uncomplicated. Lekin you can always take a tablet of Urispas and you can go for this syndromic management of your vaginitis. It's coupled, ek saath hota hai, which you don't find out. So it's like that. Do you want anything more on it?
No,
Melissa?
no, ma'am. Thank you so much for your information.
Thank you.
So then you can read this Bhashwati Sharma. She asked, she said, yeah, thank you for the wonderful presentation for both of you, she has written.
Thank you.
Nowadays, ovarian tumor disease is rising day by day. I want to know about the cause and also the necessary steps for its prevention.
Okay.
Ovarian tumor.
Okay. Ovarian tumor. Okay, you're very correct. So ovarian tumor is genetic, right? Cervical cancer, cervical can be screened using menstrual cup. Okay, I'll come to this. Lakshmi, just give me 2 minutes. Okay, so ovarian cancer is genetic, fine. It progresses very quickly. It progresses very quickly. Cervical cancer हम pap smear करके उसको उस स्टेज में पकड़ सकते हैं जब वो धीरे धीरे बढ़ता है. सर्वाइकल कैंसर जो होता है, it starts with pre-invasive, then it becomes invasive. It gives you good 10-12 years. That is why you have screening. The problem with ovarian cancer is it is robust, it is fast. ये टाइम नहीं देता हमको. आप हो सकता है 1 साल पहले आपने अल्ट्रासाउंड कराया हो, उसके बाद आप अल्ट्रासाउंड करा रहे हो, ट्रांसवेजाइनल स्कैन करा रहे हो, एंड यू हैव अ ट्यूमर. इट इज वेरी स्कैरी. आई अंडरस्टैंड इट इज स्कैरी, पर इसके लिए तभी स्क्रीनिंग नहीं बनी. आपने नहीं सुना होगा, लोग कहते नहीं हर साल अल्ट्रासाउंड कराओ भाई ओवेरियन कैंसर नहीं होगा. नहीं, लोग कहते हैं पैप स्मीयर कराओ, हर 3 साल में पैप स्मीयर कराओ, सर्वाइकल कैंसर का पता लगेगा. बट हम ओवेरियन कैंसर का कुछ नहीं सुनते. सो एज फार एज स्क्रीनिंग गोज, we do not have screening protocols. What I can suggest you is women generally go for these health packages every year. जैसे osteoporotic age में वो अपना विटामिन डी लेवल्स कराएंगी, तो ये पैकेजेस होते हैं. तो आप सिर्फ अल्ट्रासाउंड ओवेरियन कैंसर के वजह से ना डरें. Don't be scared. You can undergo this package जिसमें you have an abdominal ultrasound, and with this whatever like vitamin D3 screening, thyroid screening, then fasting, postprandial sugar screening, lipid profile, ये screen कराएं. You do it yearly, fine. So if you do it yearly, yes, we are excluding it, but there is the fallacy is that पहले नहीं था अब हो सकता है, इसीलिए इस चीज की स्क्रीनिंग नहीं बनी. but you don't have to be scared for it because there is treatment for ovarian cancer, और treatments भी बहुत levels पे आने लग गई है. So we don't have to worry that much, fine. You can undergo a yearly ultrasound if that makes you, if you feel okay, fine, that is going to help me. But इसकी screening नहीं बनी है. This is genetic. You cannot do anything about it. There are so many things जिसके बारे में हम कुछ नहीं कर सकते. So first thing is don't worry about it. इतनी और चीजें हैं जो हमें पता भी नहीं है. So why me worry? We should not worry for this. You can undergo a yearly abdominal ultrasound for it. All right. And there's another thing, अगर आप बोले नहीं जैसे जैसे मेरी चाइल्ड बेयरिंग हो गई, मैं 50 years की हो गई, चलो ओवरियां निकलवा लेते हैं. But the point is क्या क्या निकलवाएंगे, कब कब निकलवाएंगे. Ovarian cancer also originates from fallopian tube, they say. तो हर चीज तो नहीं काटी जा सकती. So you do not have to worry. You can go for yearly abdominal ultrasounds. All right.
Okay, thank you, Bhashwati. I think, yeah. So, ma'am, actually, I think they can, if for everyone, it's not possible to go for every year for this, screening and all. I think if they can maintain healthy lifestyle, they are doing, if they do physical, good, matlab, diet
Activity.
and like exercise activities and all these things, they include all these things in their lifestyle.
So
If they
this,
change their lifestyle, definitely.
if you don't mind my saying,
Yeah.
so
Yeah.
there is something called a corpus cancer syndrome. इसका
Okay.
मतलब ये है diabetes, obesity, hypertension, this triad, diabetes, obesity, hypertension, जो आप lifestyle के लिए कह रहे थे, this works very good for uterine cancer. क्योंकि इससे हमारा एस्ट्रोजन लेवल्स बढ़ता है. अगर हम मोटे होते हैं, हमारा एस्ट्रोजन बढ़ता है, तो उससे यूटेराइन कैंसर होता है. सो व्हाट यू सेड, लाइफस्टाइल मॉडिफिकेशन will in general work for all kinds of ailments, not only cancer. Diabetes, sugar, in सबसे तो yes, many things can be cut down if we have a healthy lifestyle.
Yes. Okay, thank you. Yogamaya Fukansi wants to ask, I would like to know something about pre-menopause and also starting age of it. Pre-menopause.
So pre-menopausal, the Indian standard, the Indian age of starting a pre-menopausal, I'm not talking about menopause, is 44 to 46 years. And we are seeing that ages from 40 onwards, there is an increase. There is early premature aging is being seen. So this pre-menopausal phase presents in two ways. One is a lady presenting with scanty bleeding every 2 to 3 months. This is fine. This doesn't come out as a complaint. The complaint is when a lady presents with heavy bleeding every 2 to 3 months. This is the problematic part. Now, when a woman, जब एक lady को ये होना शुरू होता है, there is a variety of things she can tell you. आपको वो mood swings, fluctuation, गर्मी, irritability, annoyed, she's depressed, distressed. Okay, she's annoyed, she's depressed. You ask her and she will tell you about her pains, her headaches, how much she's suffering. This is a normal pre-menopausal transition, a very, very difficult time for many. कईयों का smoothly हो जाता है. Fine. So what you're supposed to understand is that you are doing fine. This is the time when probably you're going into menopause. Accept yourself. ठीक है, ऐसा रहेगा. गर्मी लग रही है, fine, दवाइयाँ हैं, सब कुछ है. But first is to accept it. कि ठीक है, ये मेरे को शायद वो होना शुरू हो गया है. It is fine. I have to work on myself now. Medicines are going to help me. That is the latter part of me. The first part of me is to accept it. Probably I'm going into premenopausal phase and I have to start working on myself. So then you have to realize, थोड़ी देर शांति से बैठो, go for these yogas, go for these counseling therapies. आपको कहीं नहीं जाना. Just talk to the friends you like. Give yourself time, give yourself space. इसके अलावा they say, have a balanced diet, do regular exercises, and a balanced diet, exercise, all this helps. And you need to be relaxed. Very difficult to do, very easy to say. But you are the first person who's going to stand for yourself. So we'll start with that. कि ये age 44, 45 में शुरू हो जाती है. अच्छा, इस टाइम में because your body is depleted in estrogen खत्म हो जाता है, तो हमको कैल्शियम की डेफिशिएंसीज ये सब शुरू होती हैं. तो इस टाइम आपको सप्लीमेंट्स चाहिए, आप सप्लीमेंट्स लाइए. विटामिन ई लीजिए. हाँ, इसके लिए some women they also need estrogens. लाइनिंग, म्यूकोजल लाइनिंग भी पतली हो जाती है. जो हमारी लाइनिंग को हेल्दी रखते हैं वो हार्मोन नहीं है हमारे पास हम, तो वो लाइनिंग भी शेड होती है. सो वजाइनल इन्फेक्शन भी बार बार होगा, यूरिन इन्फेक्शन भी बार बार होगा. सो इसके लिए वजाइनल के लिए एस्ट्रोजन थेरेपी भी होती है. देयर आर मेनी थिंग्स. ट्रीटमेंट की उसमें देयर इज अ लिस्ट वी फॉलो. अच्छा, ये भी नहीं तो लेट्स गो टू दिस, लेट्स गो टू हार्मोन रिप्लेसमेंट थेरेपी, लेट्स गिव यू 2 medicines, things like that. So this list is endless. Don't worry about the medicines. Start working on yourself, accepting and taking the first step. So that is what is going to help you initially. If not, you have medicines.
Okay.
All right.
Yeah, thank you. Thank you. Yeah. Yes, we have to accept our age. Yes.
Yes,
Yeah.
accepting it.
Yes. Especially for ladies, it's become very difficult to accept that
Yes,
they are
it's like,
aging and all
I
this,
know,
but accept
aging.
all
I'm
age
white hair.
are, yeah.
You don't want to see white hair.
Yeah. So, and Kavita said Dr. Gaganpreet's guidelines are too invaluable need of the hour. Everyone must meet aware of. Thank you.
Thank you
Thank
so
you.
much. Thank you.
Yeah. This question is most from Mosmi Neu to, I think this is for Dr. Kahkasha. How do I explain to an 11 years girl about her first period?
Okay, am I audible?
Yeah, but your voice is
Okay, am I
too
audible
low.
now? Fine.
Yeah, you are audible,
শুনা
but
পাইছে?
I don't
চবে
know.
শুনা পাইছে এতিয়া?
অকমান সৰু হৈছে মাতটো, ভলিউমটো।
Okay. Okay, জানিব বিচাৰিছে যে পিৰিয়ডছৰ নলেজটো কেনেকৈ দিব 11 year old girlক ন?
11
5
years,
বছৰ ছোৱালী
yeah.
এজনী কেনেকৈ
Hmm.
দিব? চ' ফাৰ্ষ্ট কথা হ'লতো তাইৰ 11 years around 8 yearsৰ পৰাই তাইক আগৰ পৰা নলেজ দিব লাগিব যে মেনষ্ট্ৰুৱেশ্যন এটা কমন নৰ্মেল বস্তু হয়, এভৰি মান্থলি হয়, এইটো ইজ এ পাৰ্ট অফ ৰিপ্ৰডাক্টিভ চাইকেল হয় এভৰি উমেনৰ। চ' আগৰ পৰাই মানে এইটো কিমান দিন ব্লিডিং হয়, কোনদিনা বেছি হয়, কেতিয়া কম হয়, চেনিটেৰী নেপকিন কেনেকৈ ইউজ কৰিব লাগে আৰু সেইটো সদায় শিকাই দিব লাগে আগৰ পৰাই। তাৰপিছত যেনেকৈ আগৰ পৰাই বেগত স্কুলত যদি গৈ আছে, স্কুল বেগত সদায় এটা চেনিটেৰী নেপকিন, এক্সট্ৰা আণ্ডাৰ গাৰ্মেণ্টছ সদায় ৰাখিব লাগে ইন কেছ যদি স্কুলত হৈ যায় বা কিবা। তাৰপিছত নিজৰ হাইজিনটো পূৰা মেইনটেইন কৰিব লাগিব, পূৰা নিজক চাফাকৈ ৰাখিব লাগিব, ৰেগুলাৰলি পেড চেঞ্জ কৰিব লাগিব, স্পেচিয়েলি ফাৰ্ষ্ট 4 to 5 days ব্লিডিং বেছি হ'ব। চ' সেইখিনি নলেজ আগৰ পৰা দি থাকিলে এটলিষ্ট যেতিয়া হ'ব পিৰিয়ডছটো স্কুলত, শ্বি উইল নট বি মানে ইমান হঠাৎ তাই টেনশ্যন খাই যায় বহুত, মানে টেনশ্যন লয় বহুত ছোৱালীয়ে, কি হৈ গ'ল মই নাজানো এইটো। তেতিয়া মানে এই নলেজটো আগৰ পৰা দিলে মানে তাই যেতিয়া হ'ব এটলিষ্ট তাই সেইটো ভালকৈ ডিল কৰিব পাৰিব যে এইটো হৈছে, এইটোতো মায়ে মোক আগৰ পৰাই কৈছিলে, চ' এনেকুৱা এনেকুৱা কৰিব লাগিব। বাকীখিনি মানে ঘৰত গৈ মাৰ পৰা মই আৰু নলেজ লাগিব, কেতিয়া হ'ব, নেক্সট মাহৰ কাৰণে কেনেকৈ প্ৰিপেৰেশ্যন হ'ব, কিমান দিন পিছত হ'ব। চ' সেইবোৰ চব নলেজ যদি আগৰ পৰা দি দিয়ে দেন মানে যেতিয়া হ'ব পিৰিয়ডছ তাই মানে ভালকৈ একচেপ্ট কৰিব সেইখিনি বস্তু।
হয়। Okay. Thank you. I think এই কথাখিনি সকলোৰে কাৰণে যাৰ টিনেজাৰ গাৰ্ল আছে 9 বছৰ মানৰ পৰা ক'লে ভাল হয় চাগে ন কথাটো, কাৰণ আজিকালি সোনকালে হয়।
9 বছৰ পৰাই কৰিব লাগে এইটো।
Okay. Thank you, Dr. Kahkasha. And Lakshmi, she is asking, this is very important, I feel also, ma'am. What do you think about using menstrual cup? Is it better than using pads? I mean, what is a doctor's view? Dr. Gaganpreet.
All right. So by menstrual cup, are you asking me about a tampon?
Lakshmi? I think, I don't know. Please, I think there's a cup also, no? It is tampon. I don't know. I have no.
All right. So there is one diaphragm. All right. So diaphragm is a contraceptive. All right. So diaphragm is a contraceptive where you put spermicidal jelly and you insert it 6 to 7 hours prior to your anticipated time of sexual intercourse. Fine. So that is how it works. Now, tampon is just like your pad placed inside vagina that soaks the blood. So there are two things that you have to keep in mind when you think about tampon or something intravaginal. Okay? That something, anything that is a foreign body inserted inside any cavity will irritate that cavity. So you have to change it frequently so that there is no infection. Because the blood that is collecting, there is a nidus for bacteria. It is just like some foreign body somewhere. You'll realize, no, isme infection ban raha hai. So that is one thing. So you have to change it frequently if you're using a tampon, which people do very frequently because of their jobs. Professional swimmers, they have to use a tampon. They cannot think of pads, right? You change it frequently. Then second is menstrual hygiene. Now, if you insert something like a tampon and you remove it, again you insert and you remove it during the time of menstruation when already the hormones are low and the lining is shedding. So there is chances of making that wall fragile, right? So you do it with careful application of lubricant, which is prescribed with that tampon. You cannot use all lubricants, right? So if you do that, and be cautious that no, you don't have to hurt yourself, and you will not find that at that time. You'll find it later, because you cannot sense your vaginal wall at that time that you've abraded it. So it may present later as a lower vaginitis, local infection. So if you think, no, you're okay with it, you're not getting repeatedly infected, using pads, you find no, tampons are better, it is your choice. But you have to take these two things in mind about your injury while inserting, removing, because it has to be more frequent. And second is that you have to keep a more frequent changeover, or else it can cause contamination and infection. So it is your choice, but you have to keep these two things in mind whenever you choose it.
Okay. Okay. Thank you.
Thank you.
I will pad is better than in this case. Tampon.
That is to do with
Easy.
profession, right?
Yeah. Yes. Yeah. So, Smita Sharma is asking, ma'am, if you could please suggest some tests to be done by both the partners to avoid STDs in a sexually active relationship.
Is that a question to me?
Yeah, it is. You.
Okay. Can you repeat the question, please?
Yeah. She is asking some tests to be done by both the partners to avoid STD, sexually transmitted diseases.
Okay. So you want tests to be done to prevent STD. So first, let us get this clear, that STD is caused by a spectrum of bacteria, spectrum of viruses. It is endless. There is no point finding out it's a chlamydia tha, urea plasma tha, kya tha. No, it's not helping you, because it is a spectrum. The hundreds of bacteria might start working together in collision. So STDs ko prevent karne ke liye, you have to keep your sugars in check. Because one thing that will precipitate all bacteria invading you is sugar, high sugar level. तो STD पर से को प्रोटेक्ट करने के लिए आपको STD के पीछे नहीं जाना, आपको अपने बेसिक हाइजीन और बेसिक हेल्थ के पीछे जाना है. मतलब you have to be fit, active, there should be no obesity. No obesity means try to not be obese. Sugar level control करिए. Now coming to how to prevent STD. STD को prevent करने के लिए हमने क्या करना है? So normally women, when they are done with childbearing, then the onus comes on the woman to avoid pregnancy, right? Males are many a times reluctant to use condoms, barrier method. Barrier method is a very useful method to prevent infection. Fine. If a male doesn't want to use condom, there is something called a female condom, FC2, right? But they say a female condom, the drawback is in the levels of pleasure. That is what they say. Female condom. The same thing that happens to a male. The general complaint of a male is we do not want to use condom because it interferes with the level of pleasure. This is what they say. So एक female condom होता है. इससे क्या होगा कि even if the husband is infected and you do not know, he might not complain. There might be subclinical infection. किसी को नहीं पता चल रहा पर infection है. The female condom can help. This is one thing. Second thing is, if you keep local hygiene, if you sense something, if you sense there is vaginal discharge on the part of the female, there is vaginal discharge, local itching, urine jal raha hai, it means somewhere you are infected. So you have to insist on a barrier contraception. Aap ya wo kuch use karenge. If the husband complains of something, it is the same situation. Aapko unse mile ya aapko unse mile, it will go on. Again, you have to use barrier method. So the best method to prevent STI, sexually reproductive infection, is condoms. Very difficult to access, especially जब childbearing की age खत्म हो जाती है. Okay, next thing is local hygiene. Local hygiene is very important. If you maintain a basic, both the couples maintain a basic local hygiene, not to do with wish wash, या इससे दूर, no. Just local hygiene, regular bathing, regular change of undergarments. That is enough to keep you healthy, provided you're not diabetic. You have to be sure of your sugar levels, because if you're diabetic, you always have a subclinical infection. So local hygiene is important. Then apart from that, there is a myth कि coitus interruptus, मतलब a male withdrawing penis before ejaculation helps. It does not help, because whatever had to be transmitted is transmitted. So coitus interruptus withdrawal is not going to help you. Then there's another myth कि OC pill से infection ज़्यादा होते, नहीं. OC pill से भी infection ज़्यादा नहीं होते, ना ही कोई कैंसर बढ़ता है, ऐसा कुछ भी नहीं है. So OC pills भी You can take it. It has nothing to do with increase or decrease infection. The best thing that prevents infection is condom. If you are not inclined towards condom, you have to maintain your basic perineal hygiene. Okay, intercourse during menstruation is also not causing any infection. This is also a myth. There is no problem with that also. Because it is your lining being shed, it is not infecting you. So that is also a myth. So local hygiene, condom usage, isko barrier method of contraception कहते हैं. This is very important. Apart from that, local hygiene is the best. It cannot cause infections easily. All right. Thank you. Ma'am, you're not audible to me.
Oh, sorry, I was mute. Okay, thank you. Himajyoti Talukdar is asking, ma'am, can yoga or yoga therapy helps our complete vaginal health?
Okay. The answer is yes. Because just imagine sitting and being calm, doing everything what you want to do, spiritualizing yourself in a positive way. Yes, it can treat many ailments. It has, and the results and the reports have shown that yes, it helps. It helps even in pain during vaginal delivery. If you start advocating yoga in pregnancy, it helps with pain, it helps with infection. And with yoga comes discipline, discipline in all aspects, be it food discipline, be it lifestyle discipline. So all these things add up. You will not be obese, you will not eat, you will not sleep for long hours. So all of this is contributing not only to vaginal health, general health. Yes, it does help. There are reports, there are clear-cut studies, because it is a way of discipline of life.
Yes, yes, thank you. Yes, yoga, we
Thank
should all do yoga and
Yes.
maintain healthy lifestyle. It's very, very important. Yeah, Hunmani, your question, you can ask your question directly, Hunmani. I have seen you, so you can unmute and ask your question directly.
Am I audible, ma'am?
Yes,
Yes.
yes.
Okay. Ma'am, there are two questions. The first one is that I have 14 years old girl and her periodic cycle is 35 or 36 days. Is it normal? Or
Okay.
at the time, sometimes she experiences cramps, menstrual cramps also.
Okay.
And
Okay.
and at the same time, my second question is that I am a teacher and I have seen that most of the adolescence period nowadays, the 14, the girls and boys of adolescence age are very much interested in having sexual pleasure, which they enjoy wrongly. And also, I have
Yes.
heard stories about using sex toys in hostels.
Yes.
I want to know about your opinion, ma'am. Is it
Okay.
right or wrong?
No, wait. First, I'll get you to your PCOD/dysmenorrhea. Okay. So what if you don't mind my asking, at what age did your daughter start her menarche?
She has at 10 years.
10 years. So initially, was her cycle prolonged, or it was 28 days, or it was always 35 days?
No, ma'am, it was irregular from the very beginning.
Okay. So now she bleeds every 35 days.
Yes, 35 or
Okay.
36 days like that.
Okay. Is she towards obesity?
No, ma'am.
Okay. So first 5-6 years when a girl starts bleeding, the cycles are anovulatory. It means she does not ovulate. It is just the uterus shedding and developing, shedding, developing. It's just like just we started cooking. So we're not pro at it. It's just like that. The uterus and the ovaries are not pro at it. So there is cyclical irregularity that is accepted for the first 4-5 years. Now, this duration of 35 days, if you have said is from the past 1 year or 2 years, that the normal menstrual cycle duration can be from 20 to 35 years as a normal variant, right? So this can be a normal duration also. Or else, as she grows, 14, 15, 16 years of age, she might come down to 30-day cycle or to a 28-day cycle. So if she is not obese, if her lifestyle is healthy, there is no PCOD, then you can be sure that, okay, 35 days can be normal for her, or it can decrease also. She might go up to 40 days also, because this is just hit and try. Body adjusting, adapting for the first 5-6 years, it happens. It's called hypothalamic regulation. It happens with every hormonal changes. So this is a normal variant. Even if you would have said she bleeds for every 2 months, I would have said it is okay. Give her time. There is nothing to worry. But you have to ensure a healthy lifestyle, so that we do not have anything setting up like obesity, PCOD. Then I would say no. Then this gap is going to keep on increasing. 35 to 40 days, 40 to 45 days, if you have something pathologic. But if it is not pathologic, you need not worry. Just keep a track of her menstrual calendar. Start writing exactly what is the duration and what is the interval. So that is going to help you. Even if it is a 35-day cycle, it is completely acceptable. 36-day cycle, it is acceptable. Nothing to worry. Fine. So this was the first
Thank you.
question. You want anything more on this?
No, ma'am. Thank you.
Okay, second question. Now getting on to premarital sex. Fine. Premarital sex is a
Yes.
taboo. So two things come in way of premarital sex. First, before 18 years, any sexual activity by any girl or boy comes under rape. Right? This is one thing.
Mm.
So this comes under rape.
Yes.
16 years say niche is POXO. Protection of children against
Mm.
sexual offenses, very severe. We cannot even go on that side. 16 years
Yes.
ke upar, if the girl says, "Nee, it was consented sex," then it does not come under rape. But the problem with this law and this girl is that this puberty and maturity has started from 9 years, right? And with today's era of so much information, so much exposure, so much knowledge, they are bound to test. They are bound to know. So premarital sex is a taboo. Nobody wants to talk about it. Because even talking to our daughters or talking to our sisters, we say, नहीं, इसको बताना ही नहीं है. इसको हम बता देंगे तो she might commit that act, right? But as a mother of a daughter myself, when the time comes, I think I will make her talk and sit and tell her, see, this is your body. This is what is something called sex, and it should not affect you negatively. You don't have to be infected. You don't have to carry the burden of diseases. You have to make a wise choice. It is your right, agreed. But don't let it affect you in a negative way. So this is counseling, mother to daughter counseling. Warning her, telling her that fine, this happens, and this can happen in any place. You see girls in schools, hostel, colleges. It is endless stories. Girls coming up, making up stories, missing periods, turning out to be pregnant and taking medicines, because even they are aware of MTP, that it is their right. They know this. They know everything. So this is exploited. I agree, but the best is to talk to them about it, because this is puberty, this rush in today's era where everything is so open and so free to them. You cannot hold them back. As a teacher, I'm sure you would obviously have better knowledge about all this. You cannot hold them back. They will not listen to you. But what you have to make them understand is, okay, I have told you the pros and cons. Now make your choice. It is your body. You decide, what do you want, HIV, STD, what do you want? If not, if you're engaging in activities, at least don't destroy your body. Use a condom. So we have to tell them that we have to accept premarital sex is very prevalent, very prevalent. It is not just in urban areas, rural areas also very prevalent. So this talking, this knowledge, telling them, fine, engaging is another part of it. But just imagine the amount of destruction you can cause yourself unknowingly. Don't let that happen. So that we can always make them aware of. It is your choice to choose the harm or the good. It is your choice. And it is a lifelong thing. This will go on. You can have this for all your life. So there's no rush to get into the wrong side of it. Go towards the right side of it. So this is important. One-to-one discussion, telling them this stigma has to go about talking. So this is very much there. Sex toys, very common. And there are instances of anal coitus in boys. That is the safest. There can be no pregnancy. There can be no harm. Anal coitus coming as POXO. Young boys engaging in anal sex because they know it doesn't have consequences. So children these days are very smart. So yes, at least you can provide them the correct information. You cannot hold them back. We have to learn and accept it. We cannot hold them back. We can provide them basic and correct information so that they themselves can guide themselves through this phase. This phase of puberty is turbulent. And especially with this exposure, it is dangerous also. All right. Does that help?
Thank you, ma'am.
Thank you.
Thank you.
This is very important actually. Proper sex education is needed
Yes.
nowadays, and especially for girls, because consequences
They are the
only
recipients. Yeah, they
yeah
are the
they are the
recipients.
recipients. And they should also know that no, you are not feeling no need to hide anything. Generally, no,
No,
they
it is
feel
a
that
difficult situation, agreed.
yeah,
But you can
yeah.
always grossly tell everybody sitting in the class that, okay, today we can talk about, say, safe sexual practices,
Mm,
right? So that
mm,
ones who are inclined can go towards the safer side of it.
mm. Yeah, very good. Thank you. Thank you.
Thank you.
Yeah, I have seen Dr. Sangeeta Misra. Can you ask your question directly? You can unmute and you can ask. I have seen you in. Okay, so I am reading her question. If a woman is diagnosed with adenomyosis of uterus at the age of 45 years, what treatment should be done?
Okay.
Uh,
So
Dr.
normally adenomyosis presents with pain during menses. All right. So that is the complaint. Now, when a woman is, and the reason of adenomyosis is that the lining of the uterus goes inside the muscle. So the muscle is annoyed. What is lining doing? It's not meant to be here. So that is adenomyosis. Muscle ke andar lining chali gayi hai. So now the point is, if the lady is already 45, in a year or so she will stop bleeding, menstruation रुक जाएगा. तो menstruation रुक जाएगा तो वो lining dead हो जाएगी. तो वो lining dead होगी तो हमको uterus को निकालने की जरूरत नहीं है. She is already 45. The first thing we start with is basic painkillers. Painkiller का treatment दो, lifestyle change करो, obesity हटाओ, right? Obesity, make your lifestyle healthy, start walking, start exercising. और menstrual control, हम menses ही कम होने देंगे तो वो lining irritate नहीं करेंगे. So we have hormones for it also. So first we give medical management. ठीक है, दवाइयों से देखते हैं, दवाई से नहीं ठीक हुआ, पेन किलर से, let's go to hormones. हार्मोन से नहीं ठीक हुआ, कितना टाइम निकाल लिया? 6-7 महीने निकाल लिए, 6 महीने और निकालने हैं, बिकॉज वंस यूर 46-47 आपका मेंस्ट्रुअल फ्रीक्वेंसी वैसे ही कम हो जानी है. यू विल स्टॉप ब्लीडिंग. सो व्हाई अंडरगो अननेसेसरी सर्जरी? If nothing resolves and the lady is adamant on surgery, surgery is advocated. It is her choice. But the point is, you can always avoid an unnecessary surgery by so many medicines that can be worked on step by step. So my first advice would be go for painkillers during menses. अगर आपको लगता है नहीं पेन किलर से बात नहीं बन रही, तो पेन किलर प्लस हॉर्मोन्स ड्यूरिंग मेंसेस और हॉर्मोन्स थ्रू आउट द साइकिल. हॉर्मोन से सप्रेस भी हो जाते हैं. लॉन्ग 3 मंथ का एक ओसी पिल आता है, 3 months पे लो, ब्लीड ड्यूरिंग 3 months, टेक मेडिसिन ड्यूरिंग दोस 3 months, ड्यूरिंग दैट इंटरवल ऑफ ब्लीडिंग. And then आप जितना टाइम निकाल सको, because eventually you will stop bleeding by 46-47. If you're adamant, okay, you can go for surgery, but अभी 1-1.5 साल निकाल लोगे, so it is going to help you. So this is the way we manage adenomyosis. At 45, very easy decision, just patience for 1 or 2 more years.
Yeah. And also healthy lifestyle, like ma'am said, exercise and healthy lifestyle. Yes, it's very important. Yeah, thank you, ma'am. And Himajyoti asks one more question. She said, she asks, pubic hair removal is good or bad? Is pubic hair protect our vagina?
No. Now, pubic hair removal, it does not help in any way. अगर आप बोलें उसको हटाने से infection कम होता है, नहीं. अगर आप गलत तरीके से हटाए तो folliculitis भी हो जाता है. अगर pubic hair natural hair की तरह है, it grows on your head, does it cause infection? No, because it is sterile. अगर उसमें vaginal discharge भी लगा होता है, secretion भी लगा होता है, नहीं. But what happens as what women experience with underarm hair, होता क्या है? Sweat tends to collect. So when sweat tends to collect, there is secondary bacterial infection and smell. बहुत ही हल्का सा बैक्टीरिया होता है, उसका कंट्रीब्यूशन सिर्फ स्मेल में होता है. एक पेरिनियल स्मेल आती है, कैरेक्टरिस्टिक स्मेल होती है. So it is not a very dangerous bacteria जो आपको reproductive tract infection कराएगा, नहीं. It is just like your underarm smell. That is like a perennial smell, so there's an underarm smell. Because of hair, हेयर में उसका ऑयल जमा होता है, उसके ऊपर बैक्टीरिया लोकली वहां ग्रो करता है, आपकी स्किन तक नहीं पहुंचता। वजाइनल स्किन, अंडरआर्म स्किन इज वेरी टफ, इतनी जल्दी इन्वेड नहीं होता। सो इफ यू वांट टू रिमूव प्यूबिक हेयर और आप सोचेंगे आपको इससे रिप्रोडक्टिव ट्रैक्ट इन्फेक्शन नहीं होगा, नहीं, ये देयर इज नो लिंक इन दीज टू थिंग्स। और अगर आप बोलेंगे कि नहीं इसको मैं नहीं हटाती हूँ तो मेरे को बार बार इन्फेक्शन होता है, नो, द रीजन इज समथिंग एल्स। सो इट इज योर चॉइस। इफ स्मेल यू फाइंड इट ऑफेंसिव, आप हटा सकते हैं। इफ यू से नहीं इट इज मोर, मुझे निकालने में बाल दिक्कत ज्यादा होती है, टू अटेंड पार्लर्स, यू टू यूज रेजर्स, यू फाइंड इट cumbersome, then you need not remove it. It is not helping in any way. Apart from smell, it is not detrimental. आपके शरीर को कोई खराबी नहीं करेगा। All right.
Okay, thank you. Yeah,
Okay.
yeah. I think yes. Thank you so much. I know, and one more question from Yoga
Please,
Maya.
please.
Yeah. So I think this will be the last question I'm taking. She said, ma'am, about menstrual cramp.
Cramps.
Yeah.
Yeah.
How
Okay.
it can be prevented.
Okay. So menstrual cramps, it is seen in all ages of women. जो पहले नहीं होता था वो भी हो रहा है, जिसको पहले होता था अब उसका बंद हो गया है. So the reason menstrual cramp is a very wide term, right? If you say a young girl who just started with her menses is coming with menstrual pain, her reason behind menstrual pain is different. If it's a middle-aged woman coming with menstrual pain, okay, I will think अच्छा fibroid तो नहीं है, bleeding heavy तो नहीं हो रही है, what are we missing? So age dependent dysmenorrhea होता है. But dysmenorrhea की treatment is quite simple if you ask me. Dysmenorrhea in any age has to be treated with painkillers. All right. So painkillers का नाम है Meftal Spas. If you're keen on it, you can take it. और ये जो dysmenorrhea की pain होती है, a woman can sense it before it starts. वो पता लग जाती है कि oh, I am uncomfortable. Maybe I am going to have dysmenorrhea. So at this time, you can take this medicine, SOS or an SOS basis, right? So it's a very simple treatment for dysmenorrhea. Many cycles you will notice there is no dysmenorrhea. Many cycles you will notice it is out of proportion, very difficult to say. So sometimes it's a spasmodic dysmenorrhea, sometimes it's a congestive dysmenorrhea, lining मोटी हो गई है, bleeding heavy ज़्यादा हो रही है, because हमारा hormonal cycle is also not fixed. It keeps on varying, right? But dysmenorrhea associated with other factors. अगर आप बोलेंगे नहीं dysmenorrhea with foul smelling discharge, I would say nahi, be cautious. There is something that is underlying, maybe infection. If you say dysmenorrhea with heavy menstrual bleeding, I would again think nahi andar fibroid to nahi aage lining mein jiske wajah se dysmenorrhea or bleeding zyada ho rahi hai. So this in itself is a very vague term. And how to avoid cramps is, one is this medicine, fine, because kai log they start before. People who have regular dysmenorrhea are very regular on these medicines and they start before they anticipate dysmenorrhea कि नहीं ये ले लो नहीं तो हम बहुत तंग होते हैं, right? Apart from this, my experience says that एक गरम सेक, especially for people staying in cooler parts of the country, अभी तो बहुत गर्मी है, but हल्का सा गरम कपड़ा आप एक कोई भी हैंकरचिफ के ऊपर आयरन रखें, उसको थोड़ा सेक गरम होने दें, keep it in turns, 2 कपड़े रखें, एक अपने पेट पे रखें ना, it relieves, it helps. A nice warm bath, it helps. So you know your happiness quotient, ki what helps. Meftal Spas is going to help. But yes, a nice warm thing on my abdomen, that helps many a times. It helps dysmenorrhea. So this is a very personalized lifestyle intervention कि अच्छा मेरे को आराम किससे आता है, अच्छा ये करके देख लेते हैं, ये करके देख लेते हैं. Medicine इसके लिए Meftal Spas है, and you have to be cautious that you're not missing anything underlying. You should not miss an infection. You should not miss a fibroid. Adenomyosis, just this also causes dysmenorrhea. If it is persistent and increasing, अगर आपको हर साइकिल में उतना ही dysmenorrhea हो रहा है, there's nothing to worry. If it is increasing over time, then there is something that you need to consult. If you think नहीं एक Meftal Spas खा के you do well, you carry on with your routine, then go for Meftal Spas, because this is a part of you. हमेशा ऐसे ही होंगे आपको menses, you cannot run away. So best is, okay, you have this medicine, keep it handy. Whenever you think it's troubling you, one Meftal Spas. All right.
Yeah, thank you. This is
Thank you.
actually common, most of women,
Very
and I
common.
also, yeah, very common. I also suffered once. Yeah. Thank you so much for
Thank
answering.
you.
And thank you all for your questions and participation. I hope you all are now inspired and determined to prioritize your health. A big thank you to Dr. Kahkasha Rahman Chaudhury and Dr. Gaganpreet Kaur and the entire ARHI hospital management and staff for collaborating with us to create awareness about women's health. And
Thank you.
everyone, please remember, a healthy woman means a healthy world. So now I would like to invite Dr. Firuz Ahmed, Director, ARHI Hospital, Jorabat, Guwahati, to share the vote of thanks. And also I request Dr. Gaganpreet Kaur if you can make Dr. Kahkasha as a host, so that I think Dr. Firuz Ahmed will join from the
So what did
your
you tell me? There were three buttons.
can you make Dr. Kahkasha as host, so that Dr. Firuz Ahmed can
Okay.
you know, there in Dr. Kahkasha's profile picture you can go and there are 3 dots. Click there.
Okay. Just
Yeah.
give me 1 second.
Yeah.
Okay, Kahkasha. All right. So
Yeah,
then
here
what do I do?
in
I click.
right upper corner there are 3 dots. Bring the cursor. If you can see 3 dot.
No, I cannot. I can see it down below. Security
Maybe
meeting
you are joining from phone, no?
phone. So is it
Yeah,
meeting
maybe.
settings?
No, there are 3 dot. You just
Okay, can you do it, ma'am? I'm sorry. Okay, have I done it?
no, I can't do, but now I am not host actually. You are only host. That's why.
Participant list. Ma'am, can you not do it?
I can't do on. You can do one thing. You just leave and again rejoin. If you leave, then again rejoin. Okay, okay. Now I can make Dr. Firuz Ahmed as. Dr. Kahkasha, you please accept this. Yeah, you are now host. Yeah, Dr. Firuz.
Good evening. So it was a nice session, I believe. So I am really thankful for all of you that you have attended this important webinar. So I am Dr. Firoz Ahmed. I am a consultant orthopedic surgeon and also one of the founder directors of ARHI Hospital. So since it's a bit late at night, so I'll not take much of your time. So I'll not. I was thinking of presenting a small presentation regarding ARHI Hospital, but then I thought that it may be a bit too long. So I'll just give you a very brief glimpse about our hospital. The ARHI Hospital, it's a promoted by a few like-minded doctors like me, and we have come up with this 150 plus bedded tertiary care multi-super specialty hospital located at Jorabat. So we have a big plot of land around 10 bighas. So parking is never going to be a problem. That's a big problem that many of the patients and attendants they face nowadays. So in our hospital, we have basically come up the few like-minded doctors. We have banded together because we have seen certain problems that have been faced not only by the patients but also the patients' relatives while trying to avail any kind of healthcare services. Many a time they are forced to go outside the state also, not because that the facility is not available in Northeast or Guwahati, but because many a time they have to run from this hospital to that hospital, this diagnosis center to that diagnosis center for different kind of tests or different kind of treatments. So there are two core visions that are guiding us. Number one is that we like to keep everything patient centric. That means the whatever decisions, whatever services, whatever protocols that we have formulated, all of them have the patient as the center of the piece, so that we are thinking mostly how to benefit the patient and also the patient attendance. That is a very important aspect that many of the hospitals or even us we tend to forget, because patient to anyhow he will be admitted and he will be getting the treatment, but many a time the patient attendance, they are very harassed. They have to go run from pillar to post, small things like bringing medicines, then visiting hours, then where to the ICU attendance, where to sleep at night. Those things, small things that may not be apparent to the hospital or hospital management, but those things actually really matter for the patient. So that has been our one of the guiding principles, how to make the life of the patient and the patient attendant far better, and both in the medical terms and also the logistic ways. And second principle that we are always following is that we want to make it a one-stop center. That means A to Z or whatever is required, uh, any department, any equipment, any infrastructure that the patient may require or the patient wants to avail, we should try to make it available in our hospital. That is why we have all the departments from cancer to cardiac to neuro to ortho to pediatrics, gynae, your gastro, from each and every department, from dentist to everything, so that the patient, once the patient comes to our hospital, he may be requiring any kind of assistance, any kind of medical test, we should be able to provide it under the same roof, so that they do not have to run from this hospital to that hospital. That has been that these two things, patient centricity and one-stop healthcare solution. So those two things, and for that we have started the OPD services very soon. Hopefully in the next 2 to 3 weeks, we're planning to start IPD, indoor patients, operation emergency, those things. So hopefully by the end of June, we should make it a full-fledged sort of hospital. And just to give you one simple example, two examples rather. I will not go into the details of like what services, but because those will always be there. Just two brief examples to illustrate our point. Number one, you might have seen most of the hospitals, if you have been unfortunate enough to, maybe your relative or your known person, somebody has been admitted to the ICU. One very big problem that the attendant of the ICU patient faces is that they do not have any place to stay, because the patient is in the ICU, so they do not have a room. So they, at night, most of the patients we see that they are just lying, they somehow try to sleep on the chair in the lobby, or maybe they try to sleep on the floor. That is a very unfortunate thing. So for that, we have made a special provision of around 2,000 square feet lounge. It will be recliners, and that will be exclusively for the ICU attendants, so that they get to stay in a comfortable way, because they are anyway very anxious because their patient is in the ICU. And second one, another point that I would like to highlight is that the blood bank, once it's full-fledged, we are trying to make it a medium blood bank. That will be the first in Northeast, so that there we plan to do all these blood donation camps along to tie up with the NGOs and other groups. And we want to proactively get the blood donated to our hospital, so that the patients who are in need of the blood, they may not have to then come and give a donor, because since we'll have enough stock of our blood bank, so then we can provide to the needy patient, not only from our hospital, any hospital the patient is admitted, if they can come with the requisite requisition letter and the official documents, then they can we are planning that they should get the blood in priority way, and maybe without any donors, because at that time, in the emergency time, they may not have any donors available. So these two are the examples where we are basically thinking how to lessen the burden of the patient and also the patient attendants. So anyhow, this is just this part today's program. It's just another one of the small steps that I think we have taken. We are supporting, and hopefully this program has been a bit of a benefit to the participants. And I wish you all a very happy International Action for Women's Health Day. And I sincerely thank all the participants, you, ma'am, Borgohain ma'am, then Kahkasha, Dr. Kahkasha and Dr. Gaganpreet, and also all the participants for taking part in this webinar and making it a grand success. I wish that we can follow it up with maybe more webinars, or maybe more even offline meets on various issues, mostly women's health issues, and will be as a hospital, ARHI hospital will always be at the forefront of supporting any kind of health initiatives like this. And with this, I thank everyone again, and good night.
Good night, and thank you once again to everyone.
Manoranjan? Manoranjan? I think we can agenda to take on. Manoranjan?
Yes.
Yes.
I think if we have finished the agenda today,
Ye-
then we can
Yes.
call it a day and maybe like finish the webinar.
Yeah.
Yes.
Yeah.
Thank you.
Okay, thank you.
Thank you. Good night.
Thank you. Good night, and take care and stay healthy.
Good night.
Thank you, ma'am.